So moving on to the next topic after hypertension. So this is hypotension. Hypo means decreased and hypotension refers to low blood pressure. Okay. So low blood pressure means how much is the normal blood pressure now? We are aware that the normal blood pressure is 120 by 80 mm of Hg. Okay, so that is our normal blood pressure, and we also studied the definition of hypertension where we told that the systolic will be more than 140 and diastolic is more than 80 or 90 mm of Hg. Then we refer it as hypertension. Now hypotension means some individuals will have their own average blood pressure. Okay, like some people can tolerate 100 by 60 also. If their BP reaches 100 by 60 also, they are okay. But there could be some other individuals who will just faint and fall when their BP is 100 by 60. Okay, or sometimes there could be an individual whose normal BP is only 90 by 70. Nothing happens to them, but there may be one more individual when the BP becomes 90 by 60, they may feel fainting episodes or they may feel giddiness. So always remember, each individual is different. Okay, their normal values may differ from the other person. Okay, but the definition of hypotension states that usually when the blood pressure is systolic BP is less than 90. Okay, when the systolic BP is less than 90 and when the diastolic is less than 60 mm of Hg, we call it as hypotension. Okay. So low blood pressure or hypotension, what happens during this time? So we know that when there is normal regulation of blood pressure, there will be enough blood circulation. All the vital organs like the brain, the kidneys, the lungs, okay, and the other organs will receive enough blood circulation and oxygen supply. Okay. Now what happens when the blood pressure is reduced? Usually there will be low flow of blood. Okay. There will be very less flow of the blood. So because of that, what will happen? It will result in decreased blood flow and decreased oxygenation to all the vital organs, including your heart, brain, kidneys and all. Okay. So continuously if that happens, what will happen is it may result in permanent damage most of the time. So as I was telling, the definition, there are various definitions given in different books, but commonly we tell that the systolic will be less than 90 and diastolic is less than 60. We can tell that it is hypotension. Okay. And now it has been changed. Recently, it has been told that a BP below 100 by 60 in women and a blood pressure below 110 by 70 mm of Hg in men. If it is less than that, it is considered as hypotension. Now, what is the main cause of low blood pressure? Most of the time, it is seen that people who are taking this antihypertensives, we have seen so many classification of the drugs, isn't it? Antihypertensives. There are vasodilators. We have got calcium channel blockers, diuretics. Then we have got beta blockers, alpha adrenergic blockers. So many drugs are there. Now, in certain patients who are having hypertension, they may give combination of drugs. Okay, and if the person is not monitoring the blood pressure, okay, at least once in a while they have to monitor the blood pressure, and they don't monitor the blood pressure, sometimes what will happen is they take the medications regularly, or sometimes they may forget and they may take twice or more than that also. That time suddenly there can be lowering of the blood pressure. Okay, so that could be the main cause. Okay, taking antihypertensives and not even monitoring the blood pressure or not even going for follow up with the doctor. Okay, so that will be the main reason. Next is not only antihypertensives, it is seen that some antidepressants, okay, like amitriptyline, that also results in low blood pressure. Next, people who are on this anti-Parkinson's drugs. Now, Parkinson's disease is a neurological disorder where the person is experiencing lot of tremors, rigidity of the body, which you are going to study in the third year. Okay, so the tablets levodopa and carbidopa, it is also told to reduce the blood pressure. Okay. Other than that, when a person is suffering with any heart disorder or cardiac disorder, Okay, we have seen that cardiac disorders can result in hypertension also. They can also result in hypotension. Now you may wonder why it is happening, isn't it? Initially, what happens is there could be hypertension because of the abnormal regulation of the blood pressure. Okay, but further what happens is there will be more and more workload on the heart, and the heart will not be able to pump the blood. Okay, because of that, what will happen, even though there is hypertension, after so many years or after so much of time, it may result in failure of all the normal mechanism, and that may cause hypotension. Okay, and we are also aware that our autonomic nervous system controls our what blood pressure, isn't it? We have got sympathetic nervous system, which is a vasoconstrictor, which increases BP. We have got parasympathetic, which is a vasodilator, which will reduce the BP. Now sometimes the mechanisms are just not going to work well. Okay, so that time it may result in hypotension also. So remember, cardiac disorders can result in hypotension. So which and all cardiac disorders? Commonly your heart failure. Okay, heart failure is also called as CCF or CHF, that is congestive heart failure or congestive cardiac failure. And arrhythmias, as I told, is abnormal heart rate and heart rhythm. Then we have got one more condition like cardiac tamponade, where there is a lot of accumulation of fluid in the pericardial space. Okay, lot of fluid accumulation in the pericardial space or in the pericardial sac. There is some amount of fluid, okay, to avoid the friction in between the layers, but excess accumulation happens. That is known as cardiac tamponade. It is also called pericardial effusion. Okay, other than that, pericarditis, where there is inflammation of the pericardium. Okay, in that case also there can be hypotension. Pulmonary embolism, where the moving clot or the emboli can dislodge in the pulmonary veins. Okay, and it may obstruct the blood flow. Okay, that also will be one reason. And one more major reason for hypotension in most of the individuals who arrive in the hospital, it is because of dehydration. Okay, dehydration, little dehydration may not cause hypotension, but when you are having severe vomiting, okay, or severe diarrhea, and one more is excess of blood loss. Excess of blood loss means hemorrhage. When you get hemorrhage, usually after accidents and all, isn't it? So that may result in hypotension. And if at all you have got a problem with the heart muscle, that is cardiomyopathy. Okay, next is sepsis. People with septicemia, okay, when there is blood infection, that time also in the end stage there can be hypotension, and that may result in further, if not treated, the person can go into a stage of shock. Always remember that. Okay, hypotension will result in a stage of shock. Okay, there are so many type of shocks which you have studied. Next is hypothermia, when a person is exposed to very cold temperature. Okay, it doesn't happen commonly in our place, but where there is very cold wave, snowfall, if they are struck outside, when there is hypothermia, what happens, your blood pressure will reduce. Okay, next is allergic reactions or anaphylactic reactions. During that time also what happens is the BP can reduce. Next is conditions of hypoxia. Now, hypoxia conditions happens in respiratory disorders like your asthma, bronchitis, pneumonia, where there is inflammation of the lung parenchyma. So, in all these disorders, what happens is hypoxia is there. Decreased oxygenation. Okay, so decreased oxygen to the lungs is happening there. Okay, and decreased oxygen to all the vital organs, which will result in hypotension. And sometimes it can be also seen in hormonal imbalance, especially during pregnancy. Okay, like we know that during pregnancy what happens, the fetus also requires adequate amount of blood volume, the mother also needs. So sometimes because of that also the pregnant lady tends to have low blood pressure. Okay, but it is not abnormal here. Okay, it's quite a physiological state. Next is acidosis, like metabolic acidosis or respiratory acidosis, and certain patients who have diabetes mellitus, when they are having nerve damage. Okay, during that time also they can go into hypotension. People who have got this head injury, what happens in head injury? Bleeding can be there, isn't it? So that may result in hypotension. Next is burns. In burns patient, what happens? There is loss of fluid and electrolytes that causes dehydration, isn't it? So because of that, again patient will be having hypotension. Excessive exercise. When you are exercising a lot, what will happen? There can be excess sweating. So lot of sweating is there, that will also cause dehydration and low BP. The last one is cardiogenic shock. Okay. Now cardiogenic shock, there is low cardiac output and all the vital organs will receive less amount of blood flow, and that may cause hypotension. Next is types. We have got three main types. Okay. Orthostatic hypotension, postprandial hypotension, neurally mediated hypotension. We'll see regarding each one of it in detail. First one is postural hypotension. Now postural hypotension is also referred as orthostatic hypotension. Okay. Now the word orthostasis means standing position. Okay, just remember that orthostatic hypotension means low blood pressure in standing position. Okay. Now the name postural only is, by looking at the name postural only, you can make out that it is something referring to position change, isn't it? So here the patient will have sudden drop in the blood pressure when they are standing up. Okay. So maybe they are sitting or they are lying down or sleeping. Okay. So when they get up suddenly, their BP reduces. Okay. And commonly it is seen in people who have this diabetes mellitus, people who are having a prolonged bed rest, like full time they are in bed rest. Okay. Who have chronic illnesses and all, or people who have got cardiac problems, burns, then dehydration, or patients who are taking some drugs like anti hypertensives. Okay, so in these type of patients, orthostatic hypotension is very common. Okay, so suddenly when they get up, their blood pressure falls down. The main reason is because of damage or inefficiency of the autonomic nervous system. Okay, so normally it will maintain a correct regulation, but here it is failing. Next one is postprandial hypotension. Now postprandial hypotension means there is drop in the blood pressure after you eat heavy meal. Now this type of hypotension is seen in older people. Okay, and also it is seen in not only in aged people but also in people who have got hypertension and Parkinson's disease. Okay, what happens when you eat very heavy meal? Normally we will not have, but these individuals will get. Okay, so in these individuals, normally what happens is after you eat heavy meal, all the blood circulation tends to go to the digestive tract, isn't it? And less blood circulation to the heart, that we are aware. So that is one major reason here. Okay. So what these type of patients can do is, they can, instead of taking a heavy meal, they can take a low and frequent diet, that is small and frequent diet can be consumed. Okay. Next is neurally mediated hypotension. So here the patient will have drop in the blood pressure when they are standing for prolonged period of time. Maybe some type of individuals have to stand for long period of time during their working hours. Okay, like it could be nurses, teachers, and sometimes even drivers. They sit for prolonged period of time, isn't it? Or traffic policemen, all these people, what happens is, the blood flow, there will be venous stasis in the lower limbs. Okay, venous stasis will be there in the lower limbs, and there is low cardiac output. The heart will receive less blood circulation. Okay, so that is referred as neurally mediated hypotension. And usually the person can have dizziness, nausea, vomiting and fainting during this time. Next is the clinical manifestations. So as I have told, hypotension means what will happen to the patient? The person's BP will drop. Okay, suddenly there will be drop in the BP. Patient will feel suddenly giddy and they may fall down. Okay, so that is called as dizziness, lightheadedness. Okay, fainting we also tell, giddiness also we tell. It is one and the same. Syncope also refers to a period of fainting. Okay, then when the BP is dropping, what happens is your brain will not receive adequate amount of oxygen and blood flow. Because of that, some symptoms will be seen like lack of concentration. The person will have confusion, disorientation. Okay, and then that will be because of mainly your brain. Okay, brain is not receiving enough amount of oxygenation. Okay, next is because of decreased oxygenation to your skin, what will happen? Your skin will be very cold to touch, very cold and very clammy. Pallor will be there, and sometimes sweating will be there. Okay, excess of sweating or diaphoresis. Patient will have or will feel a lot of fatigue or tiredness. Okay, and then increased thirst will be there in the patient. Okay, some other symptoms that are there are when the patient is falling down or having fainting episodes, there will be blurred vision, and some patients, as I told, they may also have nausea and vomiting. Okay, and other than that, some patients can have depression, chest pain also can be there, or palpitations also can be there. And finally, what will happen? Patients will have signs and symptoms of shock, that is of low cardiac output. What are the signs and symptoms of shock? The pulse will be absolutely very weak. Okay, then pallor will be there, cyanosis will be there, cold and clammy skin, sweating excessively, then rapid breathing may be there, and they may lose consciousness finally and go into a stage of coma. So that is why it is told hypotension, if you get suddenly, it is more complicated than hypertension, because suddenly the person's BP may drop and they may go into coma if it is very low. Okay, now diagnosis, how are we going to diagnose hypotension? By checking the BP with the sphygmomanometer, isn't it? Then you can slowly start asking history from the patient. Blood investigations can be done to find out what is the reason for hypotension. Okay, that is a complete blood count can be done. Electrolytes, because you should know whether a person is having dehydration, isn't it? Then electrocardiogram to know if there is any changes in the heart rhythm. Echocardiogram also can be done to assess if there is any problem with the cardiac. Then stress test, ultrasound of the legs also can be done. Chest x-ray can be done. Okay. So all these topics I have already taken in detail. Okay. Then urine test can be performed, magnetic resonance imaging and computerized tomography. How to manage a patient with hypotension? First of all, our main goal should be to prevent any complications and to provide with adequate perfusion, that is adequate blood flow or oxygenation to all the vital organs. So immediately what we used to do previously is we used to do um, there's lifting the legs, that is foot end elevation. Okay, foot end will be elevated. Here you can see it in the figure. Okay, the lower extremities of foot end is elevated and patient is lying down straight here. So what will happen is, usually when you do this, there will be adequate venous return to the heart. Okay, when you do this position, adequate venous return is there to the heart. That is the main reason you give this position. Then medical management. Now commonly we see that in the hospital, when a person's BP is dropping, we give dopamine. Okay, that is the most important drug that we give. Dopamine is there, dobutamine is there. Then we have got adrenaline, which is also called epinephrine, noradrenaline, which is also called norepinephrine, and vasopressin. But commonly the drug dopamine is also given. It is given in the form of infusion. Okay, so those drugs are also called as vasopressors. Okay, vasopressors. Now, if a person was having dehydration or like vomiting was there, or nausea, not nausea, vomiting and severe dehydration was there, diarrhea was there, or bleeding was there, in those patients, what we do is we have to replace the fluids. You cannot give water to drink, isn't it? You will start with IV fluids. If they had lot of bleeding, you can start with the blood transfusion also. Okay, so that has to be done immediately. Okay, then if there is septicemia and all, in that case we can start with IV antibiotics. Okay, next is it is very important to also monitor the vital signs of the patient. Okay, continuously monitor the vital signs and see for the signs and symptoms of shock. And if the patient is able to drink water, tell them to drink more water. And they can also take salt. We know that salt increases the BP, isn't it? Unless and until it is contraindicated, CI means contraindicated, unless and until it is contraindicated, they can take little bit of salt in the diet. And if at all, I told that some people occupation or job only is to stand for long period of time. Okay, so for those type of people, you can advise them to wear compression stockings. I suppose you may be knowing, it is usually worn by this air hostess and all, isn't it? So this compression stockings, they will usually prevent the pooling of the blood in the legs, and it will improve the venous return to the heart. Okay, commonly the stockings is worn by people with varicose veins. Okay, it avoids venous stasis. Next is avoid excess alcohol consumption, avoid coffee or quit smoking, and try to eat healthy diet. One more way is tell the patient not to sit with crossed leg. This is a figure of crossed leg. So what happens when you sit with crossed leg? There will be no proper blood circulation and there can be venous stasis. Okay, and then advise the patient who is having orthostatic hypotension that whenever they are getting up from the bed, they should get up slowly. Okay, they can first turn, then they can sit in the bed for some time and slowly stand. Okay, then patients with postprandial hypotension, what can you advise them? Tell them to take small and frequent diet, and also tell them to take less amount of carbohydrate in the diet. Okay, now some home remedies are there. Some home remedies usually that is used to improve the blood pressure. Okay, those who have hypotension, like ginger, raisins are very good. Okay, almonds are good. Then we have got carrot, lemon, beetroot. Okay, then your basil or the tulsi, that is also very good. Okay, so that will improve the blood pressure. Okay, so this is about the orthostatic hypotension. The causes of orthostatic hypotension, it is a mnemonic. If you want, you can just go through this mnemonics. Okay, then next is I just want to tell about the complications of hypotension. Now complications, what are the complications? It could be mainly your shock. Okay, and it may also result in stroke or cerebrovascular accident. Kidney failure will be there. It can also cause heart attack, heart failure, and arrhythmias. Okay, like your atrial fibrillation. So many different arrhythmias are there. Okay, so most of the time hypotension is going to result in shock.